COVID-19, what you need to know. Who is at risk of developing severe illness? While we are still learning about how COVID-19 affects people, older persons and persons with pre-existing medical conditions such as high blood pressure, heart disease, lung disease, cancer or diabetes appear to develop serious illness more often than others. Are antibiotics effective in preventing or treating the COVID-19? No. Antibiotics do not work against viruses, they only work on bacterial infections. COVID-19 is caused by a virus, so antibiotics do not work. Antibiotics should not be used as a means of prevention or treatment of COVID-19. They should only be used as directed by a physician to treat a bacterial infection. Are there any medicines or therapies that can prevent or cure COVID-19? That can prevent or cure COVID-19? While some Western, traditional or home remedies may provide comfort and alleviate symptoms of COVID-19, there is no evidence that current medicine can prevent or cure the disease. WHO does not recommend self-medication with any medicines, including antibiotics, as a prevention or cure for COVID-19. However, there are several ongoing clinical trials that include both Western and traditional medicines. WHO will continue to provide updated information as soon as clinical findings are available. Is there a vaccine, drug or treatment for COVID-19? Not yet. To date, there is no vaccine and no specific antiviral medicine to prevent or treat COVID-19. However, those affected should receive care to relieve symptoms. People with serious illnesses should be hospitalized. Most patients recover thanks to supportive care. Possible vaccines and some specific drug treatments are under investigation. They are being tested through clinical trials. WHO is coordinating efforts to develop vaccines and medicines to prevent and treat COVID-19. The most effective ways to protect yourself and others against COVID-19 are to frequently clean your hands, cover your cough with the bend of elbow or tissue, and maintain a distance of at least 2 meters or 6 feet from people who are coughing or sneezing. Is COVID-19 the same as SARS? No. The virus that causes COVID-19 and the one that caused the outbreak of severe acute respiratory syndrome (SARS) in 2003 are related to each other genetically, but the diseases they cause are quite different. SARS was more deadly but much less infectious than COVID-19. There have been no outbreaks of SARS anywhere in the world since 2003. Should I wear a mask to protect myself? Only wear a mask if you are ill with COVID-19 symptoms, especially coughing, or looking after someone who may have COVID-19. Disposable face mask can only be used once. If you are not ill or looking after someone who is ill, then you are wasting a mask. There is a worldwide shortage of masks, so WHO urges people to use masks wisely. WHO advises the rational use of medical masks to avoid unnecessary wastage of precious resources and misuse of masks. The most effective ways to protect yourself and others against COVID-19 are to frequently clean your hands, cover your cough with the bend of elbow or tissue, and maintain a distance of at least 2 meters or 6 feet from people who are coughing or sneezing. How to put on, use, take off and dispose of a mask. Remember, a mask should only be used by health workers, caretakers, and individuals with respiratory symptoms, such as fever and cough. Before touching the mask, clean hands with an alcohol-based hand rub or soap and water. Take the mask and inspect it for tears or holes. Orient which side is the top side, where the metal strip is. Ensure the proper side of the mask faces outwards, the colored side. Place the mask on your face. Pinch the metal strip or stiff edge of the mask so it molds to the shape of your nose. Pull down the mask's bottom so it covers your mouth and your chin. After use, take off the mask, remove the elastic loops from behind the ears while keeping the mask away from your face and clothes, to avoid touching potentially contaminated surfaces of the mask. Discard the mask in a closed bin immediately after use. Perform hand hygiene after touching or discarding the mask. Use alcohol-based hand rub or, if visibly soiled, wash your hands with soap and water. How long is the incubation period for COVID-19? The incubation period means the time between catching the virus and beginning to have symptoms of the disease. Most estimates of the incubation period for COVID-19 range from 1 to 14 days, most commonly around 5 days. Can humans become infected with the COVID-19 from an animal source? Coronaviruses are a large family of viruses that are common in animals. Occasionally, people get infected with these viruses which may then spread to other people. For example, SARS-CoV was associated with civet cats and MERS-CoV is transmitted by dromedary camels. Possible animal sources of COVID-19 have not yet been confirmed. To protect yourself, such as when visiting live animal markets, avoid direct contact with animals and surfaces in contact with animals. Ensure good food safety practices at all times. Handle raw meat, milk or animal organs with care to avoid contamination of uncooked foods and avoid consuming raw or undercooked animal products. Thank you for watching, stay safe.